Hi, I'm Dr. Amy Gueye Weinstein, a board-certified OBGYN and founder of Visionary Women's Health, and welcome to Menopause Uncensored. I am so excited that you answered the call, that you're here, that you're interested, because before the Oprah show aired, it was my mission to make sure that as many women of color hear this information. And I'm so grateful to Oprah for bringing the attention on a very important topic with many, many unanswered questions that women deserve to hear. So again, welcome to Menopause Uncensored, where we take the real talk Oprah started and go deeper, especially for Black women and women of color who have too often been excluded from the menopause conversation. So today we're going to talk very quickly, briefly, but in a way that's going to hopefully change your life, about hormone replacement therapy myths versus facts. So let's go ahead and dive in. Black women are less likely to be offered hormone replacement therapy, believe it or not. And they are more likely to suffer untreated symptoms. They're more likely to be offered things for depression or anxiety, or to be told to see another specialist to take care of their palpitations or heart issues. They just get the runaround more often, not only in my experience from treating patients, and this is what I hear all the time, but it's also found in the data. Studies show that even when Black women present with severe menopause symptoms, providers often under-recognize their distress or fail to discuss hormone therapy. And we all deserve access to safe, evidence-based options. And that includes understanding all of our choices: the pills, the patches, the gels, and yes, the pellets. And what works is going to be what is best for your unique situation, your body, your risk factors, and your life. So let's start with what scared everyone, the 2002 Women's Health Initiative study. It linked hormone replacement therapy to an increased risk of breast cancer and heart disease, and overnight, millions of women stopped their hormones, and it really affected their lives negatively, and generations of women were kept from treatment that was very important. But here's what the headlines left out. The women in the study were on average 63 years old, many over a decade past menopause. They used synthetic, and that's artificial progestins, not bioidentical progesterone that the body recognizes. And most risks were small and specific to older populations, not women starting hormone replacement therapy around menopause. Current research shows that starting hormone replacement therapy before age 60 or within 10 years of menopause can not only be safe, but incredibly beneficial. It may lower your risk for osteoporosis, heart disease, type 2 diabetes, and even Alzheimer's. So let's define a term that you hear everywhere, and that is bioidentical. Bioidentical hormones are molecularly identical to the hormones your body naturally produces. And that does include estradiol, your main estrogen, and progesterone. And there are several forms of estradiol, and we're not going to go into the details here. This is a conversation that a well-trained menopause provider can certainly go into more details with you based on your specific needs. But many FDA-approved hormone therapies like estradiol patches and micronized progesterone are pretty well recognized by the body. And of course, there are some synthetic forms, but they are formulated so that the body recognizes the molecule. You don't have to necessarily go to a compounding pharmacy to get them. However, there are many compounding pharmacies and companies that have come to the surface and are really trying to create a product that is of quality, that achieves stable serum levels, and again is trying to mimic the body's natural process as best as possible. Now let's talk about some delivery methods, and this is important, how hormones get into your body. And there are pros and cons to each route. The first one that I want to get out of the way is that topical vaginal estrogen therapy is going to be safe in many women, even women that have risk factors for estrogen. We're finding that using estrogen topically in the vagina is actually very safe due to the low systemic absorption. And there are many groups in my medical community that are working to get that FDA warning label off of vaginal estrogen. And vaginal estrogen can help with that dryness feeling, that Sahara Desert description that people talk about in the vagina, that grittiness, recurrent bladder infections, which is something a lot of women don't know is associated with menopause, recurrent vaginal infections, again, because of the changes that are occurring in the vagina. Vaginal estrogen can change this for you. Vaginal estrogen can change your sex life, and it is a very safe form to use. Now, there are oral estrogen pills, which are convenient and very familiar, but it must be processed through the liver. And this is what increases the clotting risk and something called triglycerides, which is in your lipid panel. So high lipids or high cholesterol. It's not as preferred for women with a history of clots, stroke, or migraines, or with a family history of high triglycerides. And then you have the patch or the transdermal estrogen, which can also be delivered in a gel or a spray. And so this is absorbed through the skin. Why? Because it's now going to bypass the liver. So we are lowering the risk of blood clot and stroke. You also get steady hormone levels, and it's preferred for women with a cardiovascular risk. Again, we're talking about a risk that does not preclude you from using estrogen. So make sure you talk to your healthcare provider about your unique situation. And then you have the pellets, which is a subcutaneous insertion. These are compounded hormones, either estrogen or testosterone, inserted right underneath the subcutaneous fat to get absorbed directly into the bloodstream. And this is usually going to be inserted in the hip area every 3 to 6 months. And it's going to release hormones slowly over time, which is what your body is used to. Now, remember, it's not FDA approved, so it's typically compounded, but FDA approval does not necessarily mean that it is not safe. There are many drugs that are used off FDA labeling in many different fields, not just menopause, that are accepted and routinely administered by your doctor. We're not going to use this time today to talk about FDA approval and how to navigate that, but we can certainly address it in a future conversation. Now, once you get your pellets inserted, you can't take it off like a patch. And so you definitely want to make sure that you're going to someone who knows what they're doing, who knows how to dose it appropriately, and who knows how to monitor for side effects and complications and do something about it should they arise. And so I caution you with going to some of these online facilities or medi-spas who do not have the supervision of a physician or a menopause certified mid-level, such as a nurse practitioner or PA, that works under a physician. This is important because this is still a medical intervention and it has to be done safely. And if someone cannot answer your questions on what are the possible side effects, the complications, and what to do about it, that's probably not the right place to get your hormone replacement therapy from. Now, let's be clear. There is no delivery method that is one size fits all. But transdermal options are going to be the safest and most flexible starting point. And it's, again, important for you to look at your specific situation and medical history with the right provider for your hormone replacement therapy. Now, there are several private companies that offer pellet protocols, things you'll hear like BioT, Avexia, Sotopelli. There's a few that are out there. And of course, they will do their thing with marketing and tell you how their pellets are superior and why they're superior. But just remember that they are compounded and unregulated. But there are many physicians who trust these companies because they do also perform independent studies on their compounds and basically establish a trusting relationship with providers who, of course, know what they're doing with hormone replacement therapy, and they are very widely used. I'm not going to, recommend one over the other, but it's a conversation that you can have with your provider. Ask them which private company they use for their pellets and why is it that they choose that company versus another, and just make sure that you are comfortable with what you're getting. I can tell you that patients that are on hormone replacement therapy in my practice have a new life. They feel like themselves again, or they feel even better than they've ever felt in their 20s or 30s. And they also have the health benefits and the added longevity, protection of their bones, their hearts, their brain. This is something that could absolutely change your life. And I think it's important for women of color to hear this, to understand that they don't need to suffer through their symptoms. If you are feeling dismissed, you're feeling like something you're going through could be hormonal, it's time to ask a new provider, a new physician. And I'm happy to give you a second opinion. You'll see in the email that there is a link for a health coaching call. If you're outside of Maryland, if you're in Maryland, certainly we can establish a doctor-patient relationship so we can navigate through this together. So here are some things I want you to do today. First, I want you to track your symptoms. I want you to track how often you're getting the mood swings, the hot flashes, the insomnia. Do you wake up at night? What time are you waking up? Are you having palpitations? Are you having brain fog? What are you forgetting exactly? Track everything that is coming up and track the frequency and the timing of it. Especially if you're in your early 30s to late 40s, you could be going through perimenopause and still having cycles. And you may notice this pattern where your symptoms are happening right before a period, or maybe during a period or after a period. And this is important to track because likely this is hormonal, and the right provider who knows what they're doing is going to be able to guide you through how to get relief. And I promise you this will change your life. Know your personal risk factors, so understand your family history, what your medical history is, and present that when you see your provider. And then ask about the different forms that are available for you and whether they are safe and which one is best for you. Again, if you want personal guidance, not from Google, but from someone who is actually an expert in this topic and who works with midlife women for over 20 years, go ahead and book a 30-minute health coaching call with me. It is only $180 if you're outside of Maryland, but if you are in Maryland and you have insurance that we take at Visionary Women's Health, head on to our website, visionarywomenshealth.com, and book your consultation. I really can't wait to meet you, to help you, and to get you through this rebirth, this beautiful new chapter of your life. I'll see you in the next video.